right, so thank you guys so much for joining. I am really excited to share my experience with you guys. So this is kind of just a snapshot of what my life is like, what my journey has been like. So I'll give you little tips and tricks on how to prepare for your dental school, and just tips and tricks along the way. So here is my presentation of life of a UCLA orthodontics resident. So a little bit about myself. I was born in South Korea and I moved to SoCal, specifically to Loma Linda and Irvine. I then went to the 7-year program at NYU for the BA/DDS program, and then now I'm at UCLA Orthodontics. I just went through all the way without a break. And here's my family. So why orthodontics? My parents are also in the healthcare field. My dad is a plastic surgeon and my mom is an orthodontist. And ever since I was 7, I said I wanted to be like my mom. And I knew my mom was a dentist, but I think it didn't really occur to me until later on that she was actually an orthodontist. So I always said I wanted to be like my mom, I wanted to be a dentist. And I kind of went into dental school not really knowing what dentistry was. But my parents suggested the accelerated dental program because at the time of high school, I wasn't really sure about what I wanted to do. So I just kind of took my parents' advice and then went into it because, I saw their lives and I really liked how my mom lived her life. And why orthodontics? There's a lot of specialties within dental school, but about the end of your second year, that's when you start thinking about specializing and thinking about where to apply because you kind of have to start getting your resume and your applications together so that you can apply by the beginning of your third year. So I was thinking of orthodontics, OMFS, pediatric dentistry, and aesthetic dentistry. And so I was at a dilemma. And so what I did was I actually observed faculty in each specialty. I looked at their lives, I talked to them, asked them about what their lives were like. I looked at their personality, also their appearances, and I saw there was kind of a pattern in each of these specialties. I only kind of looked at the female faculties because I thought that would be a little bit more representative of what my life would be like if I went into these specialties. And I really saw that orthodontics and orthodontists were very feminine, very lively, very personable. And they, even though they were a little bit more advanced in age, they seemed very young and lively. And that's one of the reasons that attracted me to orthodontics. What exactly is orthodontics? It's diagnosis, treatment planning, and treatment of malpositioned teeth, jaws, and occlusion. And occlusion is actually the bite. So when you bite down, there are mainly 3 ways that you can bite, and I'll kind of describe that later on. So here you're seeing a class 3 kind of underbite, what we call in layman terms underbite. And this is most likely a surgical type of case. So here we get to the examples. There's class 1, class 2, and class 3. And this is the big category of malocclusion. So malocclusion is when the bite is not right. And that's what we as orthodontists fix. And so here in this picture, you can see class 1. This is what we strive to achieve, the class 1 normal. And here you can kind of depict it as 2 puzzles kind of gearing it together. Class 2 is when the upper jaw is a little bit too far forward, or the lower jaw is a little bit too far back, or the combination of both. And so here you can see 2 puzzles, one's ahead of the other. And so that's called class 2. Class 3 is when the upper jaw is too far back or the lower jaw is too far forward, or a combination of both of those. And here with these puzzles, you can see that the upper one's a little bit too far back, lower one's a little too far forward. And you can see this a lot in patients or your friends who may have an underbite. There are also other examples like cross bites, open bites, deep bites. So here there's an anterior cross bite. This tooth is sticking out. It should be tucked in. In this picture, you can see that there's a posterior crossbite. The teeth in the back are tucked in instead of out as they should be. There's also a lot of crowding in most cases for people who are seeking orthodontics, as well as open bites where there's a huge hole even if they're biting completely down. There's also protrusion where the upper teeth are sticking forward, or ectopic eruption. This is kind of where the teeth are growing out in a weird position. This is complete class 3. This is the same thing as this, where you have an underbite. Diastema, where there's a space in between your middle teeth. And then oral habits like thumb sucking or pacifiers that may create these kinds of problems. So why do malocclusions occur? Generally 4 big topics. Number 1 is genetics. If you have big teeth and small jaws, you will tend to have crowding. Or if you have more teeth than usual, then you'll tend to have crowding. If you have less teeth than usual, you'll have spaces all over. And also habits like thumb sucking or prolonged pacifier use of, into your 7 years old. Tongue posture as well as open mouth breathing are some of the things that may cause the open bite. Also, early loss of teeth and decay can actually cause shifting of teeth. And so that creates crowding, that creates what we call impaction, when the teeth cannot come up because the other teeth have kind of crowded together. We also actually treat craniofacial anomalies. I'm sure you've seen those pictures of babies with a cleft lip and palate, and we actually treat them later in life, about 7 to 9 years old, and later as well when they have kind of stopped growing, because they have to usually get surgery in order to correct their malocclusion. So what's a typical day in orthodontics residency like? So from 8 to 9, we have case presentation seminar. From 9 to 12, we have patient care. From 12 to 1, we have lunch or master's degree courses. 1 to 2, we have case presentation seminars. And 2 to 5, we have patient care. And then from 5:30 to 7:30, we have master's degree courses or case presentation preparation. So here, I'll take us to a video of what a day in the life is like.
Hey guys, my name is Jenny Jun, and I'm a third year.
Oh, you can't. Oh, I see.
At
Okay,
UCLA.
hold on. Let me Zoom share. Let's do this. Okay. Okay, I think it should be working now. You can see it, right?
Yeah, we can see it now.
Okay, awesome.
Hey guys, my name is Jenny Jun, and I'm a third year orthodontic resident at UCLA. I've been getting a lot of questions as to what a day in the life looks like for an orthodontic resident, so here is a day.
It's golden hour. I am logging in for my orthodontics seminar for Sunny. This was actually during COVID, so that's why I'm at home.
There you go. Okay.
Today we have a lecture by Dr. Ozaki, who is an oral surgeon and a plastic surgeon. He is our craniofacial plastic surgeon that we work with to treat our patients.
This is a crazy procedure.
This is basically what I do, frontal craniotomy, and then I move the whole frontal bar.
Orthodontists are essential in treating patients with craniofacial anomalies. Our main job is to expand the upper jawbone and align the teeth for the patient's jaw surgery.
Just finished the lecture. Look at that golden hour light. I'll typically have a super duper Korean breakfast.
Clinic usually starts at 9 a.m., but due to COVID, we only have half-day clinics. We have case reports due soon, which are presentations of our patient treatment progress.
Oh my have a research meeting today at 5:30. I need to get some things done because I tend to do two things at once. I love using like a whiteboard to write down all my tasks. I write down the things that I need to do and tackle them one by one. There's a lot of stuff to do, but I will get it done. Are going to school. I bike to school. Here are all the residents and the faculty. This is our clinic.
We are here with the great Diana Velicu.
So we're going to put some PPE on. Here is Joseph, our first year chief resident.
We're doing legal.
So this is our program director. He flies in every Monday and Tuesday from Arizona.
Nope.
Not Joseph. Oh my god. I know. Those N95s are a killer.
It is currently 7:05 and we are working on our x-ray tracings for our case reports.
So we can see all the tooth movements that have happened between. So we're comparing the initial and during treatment.
Stop filming me.
It is now 11:15. Still here. This was our lives in first year. Literally every day, 11 or 12, we would be working on our. Oh my god. Look. Oh my god.
I'm so wet.
Ew. We're going home. Going home. Wow, I've gotten so much better at biking. I can actually film myself. You don't burp? It is actually pretty hard the first time. Yeah. And then you have to go to the hospital. Remember? Yeah. Look at me now. Wait, look at me now. Look at you.
kind of a mess with all of these models that I need to work on. This is all a learning experience, soaking in everything that I need to during residency so that when I go out to practice, I will be able to do all of the things that I learned. It's at least kind of an incentive. Anyway, I am gonna go, and we'll see you guys later.
Alright. So that is kind of a snippet in the day. We don't always go until 12. Now that I'm a third year, I leave clinic at the latest by 6:30. So life gets a little better from there. So how many patients do we see in a full day pre-COVID in residency? We see about 4 to 10 patients a day. And we don't see as many patients as in post-residency practice because we don't have assistants. We're doing all the work. So we take about 30 minutes for a wire change patient or a retainer check patient. And we take about 60 minutes for a wire change plus rebonding any loose brackets or rebonding any misplaced brackets, or if we want to take photos, or if you want to deliver any expanders or any appliances. And then for any upper and lower complete bracket bonding, we take about 2 hours. And in post-residency, when you go out there and practice in private practice, you see about 30 to 150 patients a day. And the average is about 60 patients. And this is possible because you have about 2 to 6 assistants. Some larger practices can have even more than this. So you're seeing multiple patients at once in multiple chairs. So basically what the orthodontist does is they go from chair to chair and they just check and tell the assistants what to do and then move on. So what procedures do orthodontists perform? There are non-surgical orthodontics as well as surgical orthodontics. I'll show you guys a example of each of them in the case presentation. And so for the non-surgical, we have braces or Invisalign. I'm sure you guys have seen that. There's also lingual braces where the braces go inside on the inner part of your teeth. And there's also types of treatments where the treatment is divided into 2 phases. If you have a child, let's say, and they have like a malocclusion that we need to fix a little earlier on, we just fix the little problem, and then later on we have another phase, which we call phase 2, where we basically put on all the brackets and then align all the teeth. Or if you don't have early problems, we can just treat you in one step, and we just call that comprehensive treatment. For surgical orthodontics, this is where the skeletal discrepancy, where the jaw discrepancy is so severe that we can't just fix it by moving the teeth. So we usually start this when the growth is nearing completion, which is about 16 to 18 years of age. And so basically at this age, we set up the teeth prior to jaw surgery so that they can move the jaw, the oral surgeons can move the jaws. And then after, we get the patients back in and then kind of just settle in the bite. And what kind of concerns do patients present with? They usually come with crooked teeth, which is what we call crowding, teeth jutting out, tooth isn't coming out when, like the canine, for example, may be stuck in the bone, or if the lower jaw is too big or too small, if they show too little or too much gum when they smile, or if they don't have enough space for an implant, we can also move and make space for an implant. Or if they're missing a tooth and there's spacing, we can close the gap. Or a lot of times the patients just say, my dentist told me I needed braces. So what kinds of diagnostic tools do we use? So we have 4 general ways of kind of looking at these teeth. Clinical exam is when we have the patient in the chair, just looking at the patient and their mouths, their facial structures. And we also take photos, which I'll show you later on. We take impressions as well, which we can kind of see exactly where the teeth are in our hands, and as well as x-rays. X-rays allow us to see inside the face and look at the bones and the teeth. I'll show you guys those later on. There's a 2D and a 3D type 2D, there's two main ones that we take, which is a panoramic and the lateral cephalogram. As well as the 3D ones, it's called a CBCT, where it shows the teeth and bones and other structures like the jaw joint, and we can basically take the three-dimensional file and then make different cuts so that we can see a lot of different views into the patient. How has ortho changed over time? Before, we used to band every tooth. This was like in 1950. But now as technology has advanced, we are now just bonding all the brackets. We have better wires, we have mini implants, we have clear aligners, we have virtual surgical planning, which is basically planning the surgery on a computer beforehand so that we know exactly what to do in the surgery. Digital scanning, where we scan the teeth with an intraoral camera, the 3D x-rays, as I mentioned before, as well as virtual treatment simulation, which I'll show you a video of later. So what did I do to get into orthodontics? If you guys are interested in going into orthodontics, this is kind of how I approached it. In the pre-dental track, I was in the BA-DDS accelerated dental program. I had taken a lot of AP classes, so I was able to just cut down a lot of extraneous courses, just take the ones that I really needed to in college. Also, because I was kind of guaranteed to get into NYU's DDS program as long as I had a GPA of 3.5 or higher, as well as a DAT above the national average. So I didn't really try that hard on the DAT. And I got a 23 on the DAT, and I think my academic average was 27 or something like that. So I still did study just in case I didn't get into NYU for any reason, but yeah, so I did that. But yeah, and then I also tried to refine my resume with grades, research, club leadership, outreach, and shadowing. I'll show you guys my my CV and my resume later on. For dental school, I tried to keep up my grades as much as possible. I studied my ass off. I was involved in clubs, class council. I was in research. I was in community outreach. I applied for scholarships, and then I went to externships to see what each of the orthodontic residencies were like in person. Let me actually show you guys my CV. Oh, actually, that's the next slide. So what advice do I have for you guys as pre-dental students? Number one is to build friends and a community around you, because you are an average of your 5 closest friends. So surround yourself with people smarter than you, more accomplished, more on top of things than you, and you will find yourself at a point where you are surprising yourself because you're very accomplished yourself. And don't regard your friends as competition, because your friends are just a very small group of people. Your competition is out there in other universities, other people who are also applying for dental school. So your friends are actually your allies, the people who will keep you accountable. So yeah, it is okay to have friendly competition, but don't be malicious, don't burn any bridges, because later down the road, dentistry is a very small community. Upperclassmen resources are also very helpful. If you seek out, and this is something I didn't know during college, but a lot of upperclassmen will have tips on what kinds of things to study for exams, or even like past prior exams. So you'll be able to see exactly what the professor wants you to know, wants to test you on, and things like that. So it'll be a lot more useful and more efficient to study those pointers. Also, these are some recommended readings I have for you guys. I read both of these and found it extremely helpful. I even used them during dental school to kind of keep me on track to, be a competitive applicant to orthodontics. And also, don't burn out. The real studying is in dental school. Dental school is going to be a lot of studying. Like 1 week's worth of lecture is probably the equivalent of like 1 semester of college. So it's really crucial that you don't burn yourself out in college. If anything, during college, figure out how your brain works and how you can memorize as efficiently as possible, because dental school is 100% memorization. If you're good at memorization, you are gonna ace dental school. And also get to know your professors personally. Like you guys have now, get your Zoom camera on so that your professors know your face, and they will be more akin to giving you a better recommendation letter when you're applying for dental school, which makes a huge difference. Instead of a generic letter, you'll be able to get a very specific letter, and a lot more, conducive to your success to getting into dental school. So what did my pre-dental CV look like? Now let's transition to my CV. So this was my CV going into dental school. I didn't, modify anything from it. So let's just look at it. I think this will be helpful for you guys. So education, GPA, I really worked on that a lot. I worked on my SATs in high school so I can get into that program. I listed a lot of the leadership programs that I was in at NYU, but I kind of wish I listed every single one of them. So I'll show you my regrets. So one thing was I didn't include everything I did. I just thought that the resume was supposed to be restricted to 3 pages, but little did I know it's a CV. So CVs can be as long as you want. So I used to also be a worship leader in the Christian club that I was in. I also was in Dr. Bart Carr's lab. I was also in Global Brigades to Honduras, and I didn't include those things in my resume. So these are just leadership. These are skills. These are research experience. Research is very important for you to get into a good dental school as well as residency. And it's because research is where you find new knowledge. And so if they see that you are motivated to enhance and further the knowledge of the future, they look very favorably on that. Also professional experience, these are all just shadowing experiences. And then also community service projects. Even if you go on a very small community service project, you can just put that on. Honestly, just put on anything and everything you have. And also, one thing I would have done differently is better graphic design. So now there's a website called canva.com, and they have amazing resumes, and you can actually modify it on the website. Also, I would have gotten a professional headshot so that they know exactly what I look like, have it attached onto or like embedded into the CV so that they know exactly what I look like, what I've done, and then kind of associate the two. So going on to my case presentations, here is case number 1. Do you guys have any questions before I move on?
There are a lot of questions, but we're gonna leave it towards the end.
Okay.
If that's okay with you?
Yeah, perfect. Okay, so this is my patient. He presented to me with this problem, and what the problem basically is that he has spacing. You see how there's spacing between his teeth, and then also if you look at these 4 molars, it is very heavily decayed. The pediatric dentist tried to restore them or like fix the decay as much as possible, but you can still see that they're breaking down very much. It looks like he doesn't brush his teeth very well. But we also saw on the x-ray, let's look at his x-ray. So as you can see, the teeth in the front are jutting out a lot, and the teeth here actually dictate what the lips look like. In this case, he has very thick lips, so even if we bring the teeth back, it won't make that much of a difference, but at least it will bring the lips back a little bit. So let's look at how he progressed. Also, when he first came to us, you can see this one, this one, this one, and this one. These three have root canal treatments. This is very close to root canal. See, this is the pulp, and this is where the amalgam filling is, and it's very close. And so basically, he's not gonna hold on to these teeth for any longer. He's 12, so he was 14. And look at these teeth down here. They don't have any space to go into. So if we don't treat him, what will happen is these teeth will be stuck in the bone. And then he'll be just left with these molars that are basically decaying. So previously in 2017, he first came to me in 2019. So this is 2019, but if he had come to us earlier, we could have actually saved him a lot of treatment time, because we would have assessed the case sooner and said, hey, okay, these teeth are probably not going to stay in the mouth that much longer. Let's just extract them, get rid of them, and then allow these teeth to erupt into place, and then just do a little bit of braces and then be done with it. But because he had come to us a little bit later, we had to basically do a little bit of cleanup. So 10 months after we started treatment, you can see that the molars are now gone. These are actually the second molars, and these are the second molars. This is where the premolar is impacted, these two teeth. And so what we've done was we've taken out those teeth. We are closing the space. As you can see, there's a lot of space, and this is the power chain that is bringing the teeth backward. Now this is 18 months into treatment. We're seeing that the spaces are a lot more closed up. We just have a little bit of space here and here, and on the lower arch we can see that these premolars are erupting, and these molars are now, protracted forward a lot more. There's not as much spacing down here as well. And then, so this is the progress x-ray. This is at 20 months. And in comparison to the initial x-ray, we can see that the incisors, these teeth, are a lot more further back, which is great for the lips. As you can see here, we look at kind of the chin to nose and lip relationship. And we can see that this is protruding a lot far ahead of the nose and chin. Here, he does have very thick lips, so even if the incisors did move back a lot, the lips are still a little bit far forward, but at least he has some room for his lips to close down, instead of here where he doesn't really have as much room to close down his lips. Also, if we look at the panoramic x-ray, this is the very beginning of treatment. We took out these 4 teeth. Now, these are the second molars, which are these teeth up here and down here. They have kind of substituted for these decaying teeth. And then now these are the third molars. The third molars are usually what we call wisdom teeth. They're usually extracted, right? But in this case, we'll just leave them, have them grow in, and then substitute as the second molars. So in his case, we won't take out the wisdom teeth. All right, so that was the end of case number 1. We're still in treatment with him. Case 2, this is a surgical patient. As you can see here, she has an underbite and an open bite as well. Her lower jaw is protrusive, what we call protrusive. It's when it's kind of more forward. She does have a very protrusive chin point as well. And you can see that she has a lot of crowding. She doesn't have enough space for all of the teeth that she has. On the lower, she has a little bit of crowding as well. Basically, what we do for these kinds of patients is before they go into surgery, we have to set the teeth in relation to the jaw. So if you can see here, in a lot of these class 3 surgical patients, the upper teeth and the lower teeth try to meet each other. Teeth tend to want to try to meet each other, try to contact an upper and lower partner. and that's why these teeth are in these positions. But because we're correcting this bite through surgery, we have to put these in the place that in the places that they will be when the jaws are moved. So we make the underbite even worse because we're going to actually correct the entire jaw, move this jaw forward, and then move this jaw back. And so we take the teeth back and we take these teeth forward. So basically the opposite movement of what we would do in a non-surgical patient. So here you can also see she has wisdom teeth. In her case, we'll remove the wisdom teeth and then bring back all of these teeth with mini implants in the bone so that we can unravel the crowding. So before any surgical treatment, we usually do what we call a PTSO, pre-surgical treatment option, and surgical treatment option. These are basically virtual treatment demonstrations, not only for the patient, but also for us, so that we can see exactly where the teeth should go. So I've made a video on this. So let's take a look at this on this patient. So she's what we call class 3 surgical. I'll just get rid of the music for just narration's sake. She has a retrusive maxilla and a protrusive mandible. Let me just move this over here. So what we do is, what I've done right there is I've basically outlined exactly what this x-ray is like and overlaid it on the face. So you will be able to see. So this is the tracing overlaying on the face. So we'll be able to see the teeth, the jaw bones, and as well as the face and how it affects the lips. So now this is kind of how I am planning to move the teeth before surgery. So we're taking the upper teeth back and the lower teeth slightly forward. And this is predicting basically where the teeth will go so that we can see if these surgical movements will be adequate. So here we're moving the jaws. This is simulating surgery. So this is what we call a Lefort 1 osteotomy advancement. This is a lower mandibular BSSO setback. I'm adjusting kind of her lips to match what the teeth and the jaws have moved to. And here you can see that she had kind of an underbite, a low protrusive mandible. Here, sorry about the lips. The lips kind of get a little bit like not as realistic on these virtual treatment plans, but you can see that the chin point is a lot more reduced. She has a very balanced face. So we save these treatment plans so that we later show the patient. We also overlay what the patient looked like initially for the teeth as well as the progress. And this is how the patient's jaw surgery will end up being. All right, and that is actually the end of my presentation. Let me know. Well, thank you so much for having me. I honestly love talking to you guys, and I actually really enjoy public speaking. So if you guys ever need another shadowing, or if you guys are curious about other things, please do let me know. And yeah, I will be open to any questions. Oh,
Have your social media, so be sure to check out Dr. Dion's Instagram. And we have a few questions for you in the chat. Is it all right if we ask them now?
Of course.
Okay, cool. So the first question is, why did you why do you have to wait a certain age to treat patients with cleft lip? Like, how does the surgery affect this?
Yeah. Okay, so actually cleft lip and palate patients have a schedule because they're born with an anomaly that affects even just very basic things like eating, breathing, speaking, and as well as, of course, the obvious aesthetic issue. We wait until the canine era. Well, this is a lot of specific things, but when they're first born, they just get their lip repaired. And then a little bit later, they get a bone graft within the palate because there's a gap between the maxilla, which is the upper bone. And then later, when they are about 7, that is when the permanent teeth start to come in, especially the upper canine. And so when the upper canine comes in without the bone being there, it's very hard to reconcile and fix that bone defect. And so at that point, what we do is we expand the maxilla and then we refer the patient to the plastic surgeon to do a bone graft. And then we get them back and then we just monitor them until they are ready for the actual surgery, which is the surgery that you actually just saw now. And you have to wait until they're done growing because the lower jaw, it actually follows your height. So as you're growing in height, the mandible also grows, the lower jaw grows as well. So if we do the jaw surgery a little bit too early, what can happen is the lower jaw can continue to grow and outgrow that surgical correction. So then the patient may actually grow out into an underbite again, and then they'll have to get surgery again. So what we want to do is we want to wait until their growth is over, make sure that this is where their jaws are going to be in their adult life, and then correct it surgically so that we don't see any unforeseen growth happening. And good question. I think you might be muted.
Okay, so sorry about that.
Oh, it's okay.
So the next question is, how did you deal with burnout or avoid it? And along with this, how did you balance your time and not procrastinate your work during dental school and residency?
Oh, great question. So I have a motto that I live by, especially during dental school, and I use kind of both of these. So what it was if you want to go fast, go alone. If you want to go far, go together. And I used both aspects of the quote. If I was really rushed for time and I was cramming, I would just do it by myself because I was on adrenaline to get this exam studied for or assignments done. But dental school and college, honestly, all of this is a marathon. And so having people around you who are as motivated and have very similar goals is very useful because you guys will know exactly what you have to do. And so you'll hold each other accountable as well as share resources, remind each other of quizzes and assignments that are like all over the place. And so I think doing that was honestly very helpful to avoid burnout because when you're complaining, honestly, it's so much more consoling when there is someone who can understand you. So by having those kinds of friends around you and a community around you, it will really help with the burnout. And this is why I say that your friends are not your competition, they're actually your allies.
Thank you, Dr. Gian.
Mm-hmm.
So the third question is, how many years is residency, or does it depend on which specialty?
Yeah, okay. So I did have a slide on this, but I thought it was a little bit irrelevant for pre-dental, but here it is. So it does depend on the residency. For example, OMFS can be 4 to 6 years. So it's kind of that's the longest residency. Endo is usually 2 years, peds can be 2 to 3 years, and ortho can be 2 or 3 years. And these are the 3 main kinds. Here is So there's a 2-year certificate where you just get a certificate, and there's a 3-year program where you get a certificate in orthodontics. There's a 3-year certificate with a Master of Science degree, which is basically what UCLA is. And also within these categories, there's academic or hospital-based. So academics are, the usual colleges like UCLA, University of Michigan, Harvard, UCSF, Loma Linda, any of those programs. Hospital-based programs are any of like the county hospitals or, usually the county hospitals, city hospitals. And the academic programs are usually tuition based, so you have to pay tuition of about $20 to $120 a year. But there are outliers. The reason why UCLA was my top choice was the compensation is very generous here. So we get $66,500 in salary, and we get a $12,000 housing stipend, as well as a $3,000 meal stipend, and a $1,000 academic stipend, totaling up to $82,500. So there's a lot of debt, going into dental school, finishing dental school, as well as going into residency in dentistry. But if you do seek out these kinds of programs, you do have to be more of a competitive applicant in order to get these programs. But it will save you a lot of money because you are earning money, whereas other people are spending $20,000 to $100,000 a year. Also, hospital-based programs do pay a stipend of about $25,000 to $51,000 per year. But usually, if you want to get into a hospital program, you need a GPR or prior private practice experience. So that's a little bit of a caveat there.
Thank you, Dr. Gian.
Mm-hmm.
And kind of segueing with this question, like when do dental students typically apply for residency programs, and how do you apply?
Yeah. So dental students usually apply in the beginning of their 3rd year. And so the deadlines are the first deadline is in August 1st, and then it ranges up to usually about like the end of September. And how you apply is very similar to how you apply to dental school, but it is a different platform. So for dental school, you apply through ADSAS, right? For residency programs, you match through the Match Pass platform. And so through that, you can upload your resume, your personal statement, your recommendation letters, and any supplementals. It's very similar to college applications, dental applications. It's just another round of that, just a different website.
Thank you, Dr. Gian. And this kind of also asks us another question about residency. So did you apply anywhere else other than UCLA for your residency? And why did you choose UCLA specifically?
Of course. So usually, to be safe, people tend to apply to 20 schools for residency. This is a lot less than medical residency, by the way. They apply to like 100. But 20 is kind of that number. I didn't apply to as many schools. I applied to 13. And maybe I was being a little bit naive, but at the time back then, UCLA was what we call non-match. And matching is kind of like, those algorithms in dating where, those dating shows where it like pairs you up together. That's kind of what this match system is like. And so what you do at the end of your interview cycle, so what you do is you apply, and then you get all of those invitations for your interviews. And then you go and interview, and then you come back, and at the end, you rank all of your programs by your preference. the programs also rank the interviewees by their preference. And with all this like dubious algorithms, they pair you up, and you basically have to go to the program that you're matched with. But for me, UCLA was a non-match program, meaning once you go and interview, if they like you, they will just call you up, say, hey, like we like you, we will send you an acceptance, and then you have to withdraw from the match system. And so that's actually what I did. I was really fortunate because I wanted to go to UCLA. UCLA is very well known in the orthodontic field, from a lot of research as well as what you call maxillary skeletal expansion. And so I really did want to know how to do that. And also, my mom is an orthodontist, and so she was able to kind of shed light on what programs are good and what programs are not as good. And so that was very helpful for me. And a lot of people have the misconception of thinking, oh, like the best college must have the best residency as well. It's not necessarily the case, because those, top colleges that you may associate, very high standards to, may not have as many patients as you may think. And so, for example, like Virginia Commonwealth is a great program, but not very many people may know of Virginia Commonwealth. But it is a very good program. So even within the specific specialties, there are programs that are higher or lower. So yeah, that's one of the reasons why. And also UCLA pays you very generously. So that was another factor, as well as my family being here as well.
Thank you so much for answering the question. Our next question is, how was NYU for dental school? Was it more clinical or research based?
Honestly, NYU is a huge institution, so there is a ton of research going on. There is also a ton of patient care going on. It's just depending on what you want to immerse yourself in. NYU is the biggest dental program, and so you will actually get to see and meet a lot of people. Even on graduation day, I was meeting new people, and so I really liked that part of being in NYU, because you get to interact with so many different people who are in the same field as you. And so even when in college, I wasn't very diverse in terms of my friends, but once I got into dental school, I had so many diverse friends from pretty much every ethnicity. And also I got to live in New York City, so that was awesome. And also, I think a lot of people think that NYU does not have patients, but there is so many patients at NYU. I honestly was always booked. And I think one thing that you may want to know about NYU, in terms of specializing, is you do have to work a lot to compete with other people, because it is a grade-based program. Whereas some other schools, like UCLA School of Dentistry, is a pass-fail program. And so the pass-fail programs are a little bit more conducive for specializing, because they don't report grades. So that is one thing that you may want to consider if you want to specialize. But other than that, honestly, I got a very good clinical experience from NYU. I also got a lot of research background as well in NYU as well. I was like involved in 4 research. There's so many research going on in NYU. So honestly, it is a research and a patient care program.
How do you know if a school is more clinically based or research based?
In terms of residency or dental school?
I'm assuming both for this question that the person asked.
Okay, so how do you know if the school is more patient based? You will actually have to talk to the students themselves, or I guess you can go and shadow, but I think with the COVID situation, it's a little bit harder. Um, yeah, it is. It's probably best to talk to alumni or students that are currently attending the school in order to see how many patients they see, how many case requirements they have. This could actually be kind of a good comparison as to how many crowns you're required to deliver, or how many fillings you're required to do, or cleanings. Because the more patients they have, the bigger requirements they can set. So if they have lower requirements, then they usually probably don't expect as much patients to come in, so they lower the requirements. But yeah, just ask them, ask like a third or fourth year how many procedures they have done, politely. And then yeah, just see if what their take is on the patient care portion. In terms of research, I'm pretty sure every university does research. What a lot of people mean by research-based program is that they don't really have that many patients, meaning they do research because there's not that many patients. So that I think that's kind of what I kind of take it as. So yeah, if you do want to go into academics, like be a dean of the school, or you want to be a faculty in a dental school, then going into research is great. Whereas if you want to be a clinician, you want to work in private practice, then definitely go to a patient care based system, based school, so that you can have as many dental experiences and clinical experiences before you graduate.
Thank you for answering the question. Another question is, when you see a patient, how do you develop a treatment plan or decide what to tackle?
That's a great question. So yeah, that's one of the things you have to learn in residency as well as when you're out in practice. So when the three types of malocclusions, let's go back to this slide here. So even as soon as the patient comes in the door, nowadays it's a little bit harder with COVID because everyone has masks on. But when you look at a patient and you're just talking to them, even I see it in my friends nowadays, but you'll be able to see kind of how their lips are, how their nose and chin balance is. And so you'll already kind of know which classification the patient is, even as they walk in. And then you seat them in the chair, you look at their teeth, their face, ask them what their chief complaint is, and that's kind of their chief concern. Why are they here? That's what we call a chief complaint. And then that's what the patient wants you to address. So we'll see all of the problems, we'll diagnose it, and then we'll treatment plan it based on the problems that we see. Yeah, and basically we choose the tools to match the problem.
Thank you, Dr. Young. So the next question is, if you could go back into your educational journey, what would you tell yourself to do differently?
How far back? Well, okay, let's go through each. College. Honestly, in college, I would have told myself to speak to more upperclassmen. I think I did fine in terms of grades and things like that. But I think if I had talked to upperclassmen and gotten their notes and their tips, I could have done even better. Honestly, it didn't really matter because I was in the 7-year program anyway. But if you are going to apply for dental school, that is honestly the biggest tip that I can give you to do well in school. So definitely like befriend your upperclassmen. But you have to befriend a smart upperclassman. If you befriend a dumb upperclassman, that might actually hurt you more than help you. And let's see. Also another thing is I would have gotten more feedback. So let's say, for example, my resume or my personal statement, I did show it to people, but I wish I showed it to even more people, especially those who have already applied to dental school. And you guys are doing great. Like, you guys are reaching out to people who have already gone in the paths that you want to pursue. So this is honestly, you guys are already doing it. So maybe I don't even need to give you guys this advice. And in dental school, honestly, it was really grueling. Dental school is very stressful. Wherever you go, honestly, it's so much knowledge you need to pack into your brain. Um, Honestly, I don't really have much regrets about dental school. I think by having such a great community, and we had about eight of our friends in what we call the study club, study group. Yeah, and we didn't just study together. We like drank together, like partied together, hung out together. Like after exams, we would just like party, go eat and things like that. So it was like a community. It's like a family that we can support each other through. And we had like a group chat where we were just talking about everything and everything. And like before exams, we would be quizzing each other, like asking each other questions about like things that we didn't know, things that we thought were important, but we knew were going to be on the exam. And sharing resources like that. Yeah. And then in residency, honestly, I don't have any regrets about my residency either. But I think one of the things that I definitely benefited from was surrounding myself with, again, like really smart people. My two closest friends are super, super knowledgeable, super on top of things. You saw them in the video. And they honestly, we keep each other accountable. We always challenge each other to know more things, to be more prepared, to like read more literature and things like that. So those three, all of them are people. Basically, it's all about people. Yeah, and finding the right people around you so that you can enhance their lives as well as your life as well.
Great advice, thank you. Our next question is, do you have to find or compete for patients with other dental schools, or are they assigned?
With other dental schools, I'm guessing this is in
With other dental students, sorry.
Oh, with other dental students. In dental school, you mean? Honestly,
Yeah.
Once you are assigned the patient, that is your patient, and like no one should basically, no one should do procedures on that patient unless you guys agree to share patients or whatnot. I mean, I have heard some malicious stories about patients being like treated by another dental student. But that shouldn't honestly be going on, and if that is caught, they are disciplined. But in terms of getting patients in the very beginning, if you hustle a little bit more, you will get more patients than people who don't, hustle. And hustling in like the good sense, like being on top of things, going to outreaches, and then going to, the admissions clinic to gain more patients. So honestly, it really is up to you as to what you want to do. So if you are more motivated, you can see more patients. If you want to do more research, you can do more research. It's up to you.
Thank you, Dr. Dion. And the next question is, how was your experience at Adelphi University for undergraduate and for the NYU BA/DDS program?
I actually didn't go to Adelphi. You mean Adelphi University?
Yes, Delphi, sorry.
Oh, okay. I actually didn't go to Adelphi. So there's actually two programs with NYU dentistry. One is Adelphi undergrad with NYU Dental School. There's another program where it's undergrad in NYU and dental program at NYU. So I was actually at the dental program, the undergrad at NYU and dental program at NYU. And so, I was just actually in Manhattan all 7 years. I was just in, the Washington Square Park with the arch. Yeah, that was my campus. And then the dental school is on 23rd Street, which is a little bit further north and east. So it was completely different campuses, but I got to kind of explore both areas deeply.
Okay, the next question is, how did you find externships for dentistry?
I actually didn't extern for dental schools. I externed for residency. But you can visit dental schools if you want. This is like not taking COVID into consideration. But yeah, you can definitely go visit dental schools. I have heard of my friends doing that in the past. For me, honestly, I didn't do it for dental school because I was locked in at NYU. But for residency, what you do is you just go on their website, you get the secretary's name, you email them, hey, my name is blah, 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 I am a third year dental student at NYU. I wanted to see your program because I'm very interested in your program. Your program seems to be an excellent orthodontic program. Please let me know what I should be doing to gain an opportunity to get to visit your program. And then they'll send you all of the information. You might have to get some signatures from your dean, but other than that, it's pretty straightforward. Some programs actually won't let you shadow. That was kind of a red flag for me because a lot of some programs that are a little bit lacking in terms of patient care or if they're a little bit deficient in some way, they might not let you see what their clinic is like. Honestly, but this is not taking COVID into consideration. I don't think any residency is allowing people to visit because of COVID now. So this is a little bit pre-COVID advice. But yeah, so that was one of the red flags that I had when I was externing.
I have a follow-up question to that. So how do you know if like a dental school has a lot of patients? And is there like a way to see their stats?
So honestly, the dental school will not publicly show it because it's kind of like showing you all their cards so that you can compare dental schools, and they don't really like that. So you will have to talk to a student there. And it is a little bit dubious whether they will tell you, the accurate information or if they'll not. So yeah, the chances are if you have a close friend or an alumni that you trust, that may be the best approach to see if they have as many patients as you want.
Thank you, Dr. Gian. So the next question is, how did you handle debt or like pay for dental school or residency?
So a lot of my friends took out student loans. They are like federally funded, and so they have lower interest rates. I was actually very fortunate to have some scholarships for my college. So half of my tuition for college was paid for, and I just had to pay the other half. And then for dental school, my parents supported me. I was very blessed. And then through residency, I earned money, so I was able to be financially independent.
Thank you so much, Dr. Gian. Our next question is, how do you study? What are your study methods to return information?
Yes, this is a gold mine. This is a great question because I literally just did everything and anything to get great grades. And because honestly, if you don't have the grades, then you're basically out of the options for the candidates. So because they filter by grades, I knew grades were very important. So every exam I was just cramming. But there is a dumb way to study and a smart way to study. The dumb way to study, well, not dumb, but not as efficient way to study is if you study all the material from bottom up. This is like basically starting from the base triangle. Um, so your brain is actually a lot faster and a lot smarter than you think. What we want to do is we want to build a really strong foundation and then work our way up, which is great, which is ideal. But when you go into dental school, there's just like a waterfall amount of data coming to you, and you just have to memorize everything. So I took it from a top-down approach. So I looked at the study questions, like previous exams and things like that, if there were any, looked at the questions and saw, okay, this is the most relevant and crucial amount of information. And then I looked deeper into each question. Okay, this question is talking about, blank. Let's look into blank. And then like built my foundation there. So I made that little sliver of a triangle in terms of the pyramid, right? And then basically like built it from top to bottom so that I could kind of focus my energies on things that are super important. So this is why I was talking to you about upperclassmen and how they are very resourceful, because they know what was on the test. So they will be able to tell you, okay, study this, don't study this. Using your time wisely on things that are important, prioritizing high yield questions is very important. Number 2 is memorization. Memorization is key. If you can memorize, you will ace dental school. And one of the things that I found, actually, let me tell you guys a story. In first semester of dental school, I was in the library at 12 a.m. with some of my friends, and we were just studying, so sleepy. It was like right before an anatomy exam, and we were just cramming, and one of my friends said, hey, that one guy, he actually got 100 on an exam, on the last exam, and he only studied like 3 days, and my jaw literally dropped to the floor. And I was like, what do you mean? Like, and my friend said, yeah, he has photographic memory. I was like, no way. Like, I don't want photographic memory. If that guy has photographic memory, I can have photographic memory. Because like he didn't really seem like the smartest person ever. So then I looked it up. I Googled it. Google's the all-knowing. And I said, how to get photographic memory. Turns out there is no such thing as photographic memory, but there is this technique called memory palace. I don't know if you guys have watched Sherlock Holmes or read Sherlock Holmes, but this is how he remembers things. And I thought it was kind of all a myth, but it's very effective actually. So if you guys want to kind of go through this exercise with me, picture your childhood home. You can actually picture exactly the door, the layout of your house, as well as like the bed, the shampoo, and everything like that, right? So us as humans have a heightened ability to remember spatial memory. And so memory is all about tying things that you know to things that you don't know. And when you get into dental school, it's all of like you're slammed with things that you don't know, and they have no links to things that you know. So what I did was, and what this technique teaches, is to link places to things that you need to memorize. And so I would imagine like a tooth on my bed, and like remember all the details on that bed, so that I can link that bed with this piece of information that has no links in my memory to me. So if you guys are like more curious about this technique, and honestly, if you guys start in college, you'll be able to refine it more and more and more until you get to dental school, and then you'll like be like memorization kings and queens. So look up memory palace technique, and you will be mesmerized by what your brain can do. Honestly, that technique alone made dental school all worth it. So memory palace technique. Look it up.
That sounds really cool. I didn't know that Sherlock Holmes used that technique, but thanks for telling us.
Yeah, no problem.
I will for sure try to check it out.
Yeah.
So the next question is, Do you have any tips on how to make friends with smart people, I guess, during COVID times?
During COVID times. Well, how I did it during pre-COVID time. Let me like talk about pre-COVID time and let me give you ideas on maybe like COVID time. Pre-COVID time, I would just be at the library because I was at the library like from day and night. I would see the people who are at the library. And so we'll be like, "Hey, like you're always here at this time, like let's like sit together and like go out for coffee, like take a break a little bit." And so you end up befriending people who are in your vicinity, right? And so if you are at the places that are conducive to studying and where the smart people are at, then you are bound to find smart people and people who do well. And so seek out those places and just kind of like band together. Um, in terms of post COVID time, I think how you should approach studying with people is maybe find people who have very similar goals as you. For example, you guys all want to go to a great dental program, I'm assuming. And, you know, like have very solid goals. If you guys, let's say, have a very similar time that you're going to take the DAT, that's so helpful because you guys are going to be on the same schedule, going to hold each other accountable. And then, you'll take a lot of practice exams to get ready for the DAT. Like share your test scores and then help them on things that they're weak at, and then you'll get help on things that you're weak at. And then over time, you'll kind of see the levels of where people are at, and then you'll be able to kind of judge which people you want to, seek help from.
Thank you, Dr. Jian. One more question is, how do you recover from a bad grade in dental school or residency?
Okay, so residency actually doesn't have grades unless you're in a master's program, but that's honestly not too difficult. I mean, it is difficult, but you'll get through it because you have people around you. I remember one time that I failed a practical and I thought the world was over. It was a class 2 slot, which is basically a filling. So you have to drill a tooth and it's an exam. And I failed it. And I thought, wow, I don't deserve to be a dentist. If I fail this, I'm just going to mess up everyone's teeth. What really helped me was talking to my mom, or like, in any other people's cases, talking to an established dentist. It really helps to talk to them because they've already gone through it. Like failing in dental school is kind of like a rite of passage. Like you have to fail at one thing. Like, yeah. So don't be discouraged if you fail a practical, fail an exam, fail a quiz, or like don't turn in an assignment. Like it's only a drop in the water. But then again, don't do it too many times because then you'll just botch the entire grade. So, talk to people who are above you and learn from your mistake. Get up really quickly. Give yourself a day to kind of mourn over the things that, you haven't done right. But what I did was I made a list of things that I didn't do right. And then I made a list right next to it of how I'm going to correct it. And then I was like, okay, like at least I know now what I'm not good at. And so I know what to work on. And it's not gonna, figure itself out in a matter of days, but over time, if you know what you're bad at, you know that you need to work on it. So at least by knowing that, your brain will try to improve itself and improve yourself over time. But yeah, definitely find support systems that will not cut you down, but encourage you, say it's okay, and then just find ways to recover as soon as you can.
Thank you, Dr. Jian, for that amazing advice. The next question is, how do you recommend getting closer to your professors or dentists? Like, do you have any advice for that?
Sure, yeah. So, professors, I went to a lot of office hours. I'm sure they still have it over Zoom. So, for example, for just assignments, I would complete the assignment, go to the professor and just, go over it or like ask them questions, and then turn it in. Or even if it's not like that, if you just want general advice, saying, hey, like, I really, like, thank you so much. Okay, first of all, thank them. Because honestly, like, public speaking is a really hard job. And so, appreciation goes a long way. And number two, ask them for advice, for questions on things that they're experts at. Because it's very flattering for people to ask you for their expertise, and so don't hesitate to do that. And thirdly, ask them about their personal life, like how did you become a professor. Like I'd be super curious as to why you picked this, and what life advice do you have for me. Get to know them as a person, not just your professor. And dentists, like nowadays there's Instagram, so you can reach out to people on Instagram. You can maybe if you have your own dentist, you can reach out to them, or have connections through your dentist, or family, friends, parents, things like that. Anyone and anyone, yeah. Everyone, anyone.
Well, thank you so much, Dr. John. Our last question for the night will be, what do you find challenging about your profession?
Wow, this is a very deep question. What do I find challenging about my profession? Honestly, I am super excited to start working. I think one of the things that are a little bit challenging is right now in orthodontics, a lot of people are trying to get a piece of the pie. So I'm sure you've seen like at-home kits for like, aligning teeth, and Bite, Smile Direct Club, those kinds of clear aligner companies. And so I do see a lot of mistreatment of patients going on. I mean, some cases will be fine, but others that maybe like surgical cases might be botched by going to these kinds of companies that are not manned by dentists or orthodontists. And so I think in terms of kind of defending our own specialty, I find it a little bit challenging in that sense. But I think the field of orthodontics is expanding. Those kinds of companies are catering to people who wouldn't have gotten orthodontics because they don't have the financials to get braces anyway. So yeah, just those kinds of things. I think my journey through dental school and coming here was very, it was hard, stressful. It was grueling at a lot of times. But yeah, you just get through it, you build it. Yeah, so I think it's just a lot of perseverance. Seeing this as a marathon, and just getting up, doing it again. And yeah, just tenacity, perseverance, discipline. One more advice that I do have for you guys is make a plan every day of things you need to do. And then plan your day by day. In the book that I did recommend before by Cal Newport, I don't know, let's see, these books, it will tell you how to schedule your day. So schedule your day, and it will honestly, like day by day, you will like gain accomplishments, achievements, things to put on your resume, and you will see so much results. So yeah, discipline is also very important and hard, but you can do it.
Thank you, Dr. Jian, for your time and answering all of our questions. And thank you to everyone who joined us today. And yeah, thank you again, Dr. Jian, for just being here with us. And before we end today's session, the link for the quiz will be posted in our GroupMe. And yeah, just thank you all for attending. Thank you, Dr. Gian, and we hope you have a great day and
Awesome.
well, night, I guess.
Thank you guys. Good luck and everything. And you guys are doing awesome by seeking out, advice and things like that. So keep it up.
Bye. Thank you
Bye.
again.